People's lives are complex. Some of the diagnoses we have, everybody's different. For students to be curious and interested in people's lived experience is absolutely essential. My name is Dr. Louise Phillips, and I'm also a senior lecturer in mental health nursing. Mental health is relevant for everybody. Everybody's interested in mental health. Sometimes people are quite uneasy regarding the subject. We really encourage curiosity, asking questions, being critical about medical approaches to mental health, for example. And that's what I love. I love exploring the subject. I trained as a registered mental nurse in an asylum in Surrey. After my training, I worked in residential care, homelessness, mental health. My career in academia really started when I met colleagues who were doing lecturing and practice. The course is made up of 50% theory, so students do several modules relating to long-term care, for example, leadership and management, biological understandings of mental illness and physical illness. We're very keen that students learn physical skills because there's a necessary correlation between physical health and mental health. And the other half of the programme is in practice, and we're very proud to say that our students go into practice in wonderful diverse areas of London, Tower Hamlets, Newham, City and Hackney, and our students really value those experiences. The majority of our students have placements in ALFT, which is East London NHS Foundation Trust. The placements are made up of acute areas and also community specialist areas, so students might work with children and adolescents, and also students would have a forensic placement as well. There are quite a number of opportunities for students when they complete the MSc Mental Health Nursing course, and many students then can specialise. So we've had students who then work in CAMS areas, that's child and adolescent mental health. Forensics is very popular with our students as well. We're very proud of our support of students. Actually, we have student union at the university, we have student counselling mental health service. Now is such an interesting time to become and train as a mental health nurse, particularly following the pandemic. Depression during the pandemic doubled, and people's isolation has been particularly difficult. So I always say to students, you're really needed at this time.